Hello Medicos, welcome to our YouTube channel, The Exploring Medico. Last class we discussed about acute inflammation. Today we will discuss about chronic inflammation. So chronic inflammation, it is defined as the long-lasting inflammatory response in which tissue destruction and inflammatory occur at the same time. It may occur by one of the three ways. First, chronic inflammation following acute inflammation. When the acute inflammation is extensive or the bacteria survive and persist in small numbers at the site of acute inflammation, it may progress to chronicity. Second is recurrent attacks of acute inflammation. Repeated bouts of acute inflammation occur. It may culminate into chronicity of process. Third, chronic inflammation starting de novo. Inflammatory response is chronic from the beginning when either the infection occurs with microbes of low pathogenicity. General features: mononuclear cell infiltration. It is inflammatory cells like phagocytes and lymphoid cells may appear at the site of chronic inflammation from chemotactic factors and adhesion molecules for continued infiltration of macrophages, local proliferation of macrophages, longer survival of macrophages at the site of inflammation. Second, tissue destruction and necrosis both are central features of most forms of chronic inflammatory lesion. This is brought about by activated macrophages, which release a variety of biological active substances. Proliferative changes: as a result of necrosis, proliferation of small blood vessels and fibroblasts is stimulated, resulting in formation of inflammatory granulation tissue. Systemic effects: fever, anemia, leukocytosis, ESR is elevated, amyloidosis. Types of chronic inflammation. There is two types of chronic inflammation. First is chronic non-specific inflammation and second is chronic granulomatous inflammation. Chronic non-specific inflammation: when the irritant substances produce a non-specific chronic inflammatory reaction with formation of granulation tissue and tissue repair by fibrosis, it is called non-specific inflammation. For example, chronic osteomyelitis, chronic ulcer, and lung abscess. Chronic suppurative inflammation is a variant form of its response that combine features of chronic and acute inflammation. Chronic granulomatous inflammation. Granuloma is defined as circumscribed, tiny lesion about 1 mm in diameter, composed predominantly of collection of modified macrophages and rimmed at the periphery by lymphoid cells. Derived from granule, meaning circumscribed granule-like lesion, and oma is indicates a localized inflammatory mass of macrophages, for example, tuberculosis, syphilis, actinomycosis, and sarcoidosis. Evolution of granuloma. Formation of granuloma is type 4 hypersensitivity reaction. Cell injury leads to failure to digest agent and weak acute inflammatory response. So, engulfment by macrophages and monocytes, it engulfs the antigen and try to destroy it, but since the antigen is poorly degradable, the cells fail to digest and degrade the antigen and instead undergo morphological changes to transfer into epithelioid thalloid cells. So, it leads to activation of CD4 plus T cells and monocyte chemotactic factors. That's why accumulation of tissue macrophages and proliferation of T cells activated And macrophages activated by interferon gamma, it leads to either transformation to epithelioid cells or giant cells or secretion of fibroblastic proliferating cytokines and it formation of granuloma. Morphology of granuloma: epithelial cells like appearance, somewhat elongated cells having slipper sap nucleus. Nuclear chromatin of these cells is vehicular and lightly stained. Epithelioid cells are weakly phagocytic. Second, multinucleate giant cell formed by fusion of adjacent epithelioid cell and may have 20 or more nuclei. Nuclei may be arranged at the periphery like horseshoe or as a ring or may be clustered at two poles. Lymphoid cells: as a cell-mediated immune reaction to antigen, the host response by lymphocytes is integral to composition of granuloma. Necrosis may be feature of some granulomatous fibros and fibrosis.